Hello everyone, my name is Hiroyuki Takamaru. I am working as an endoscopist at National Cancer Center Hospital, Tokyo, Japan. I am thrilled to talk about our paper that was recently published in GIE titled Comparison of Post-Polypectomy Bleeding Events between Cold Snare Polypectomy and Hot Snare Polypectomy for Small Colorectal Lesions, a large-scale propensity score matched analysis. First, I'd like to acknowledge the contributions of Dr. Saito, Dr. Hammond, Dr. Mizuguchi, Dr. Cho, Dr. Sekiguchi, Dr. Yamada, Dr. Sakamoto, Dr. Matsuda, and special thanks to my wife Tomoko for her unwavering support behind the scenes. Now, let me start with the background of our study. Recently, an increasing number of colorectal lesions has been resected using cold snare polypectomy, which was used to resect small colorectal polyps without electric current in many hospitals. We also use cold snare polypectomy for many colorectal lesions that were previously resected by EMR or polypectomy in our institution. Before the procedure, we usually explain to the patient that the bleeding after polypectomy was extremely rare. However, I have come across several patients with or without antithrombotic agent who showed post-polypectomy bleeding after cold snare polypectomy. This was the starting point of this study. It is well known that post-polypectomy bleeding occurs more frequently in patients with antithrombotic agents, while less frequently occurs with cold snare polypectomy than with conventional endoscopic resection. Several studies have reported that there was no post-polypectomy bleeding after cold snare polypectomy because the event probability is extremely low. However, the actual rate of bleeding after polypectomy remains unknown. To clarify this, we analyzed a large number of patients to determine the actual rate of post-polypectomy bleeding after cold snare polypectomy for small colorectal lesions less than 10 mm in size. Now we are promoting Japan Endoscopic Database Project JED. JED is a database combined with endoscopic reporting system. We can directly input the endoscopic findings, the backgrounds of patients, and adverse events prospectively in daily practice. And then JED enables us to use the data directly for many studies. Furthermore, we can integrate an endoscopic findings and histopathological diagnosis in a one-to-one correspondence. We analyzed more than 12,000 colorectal lesions treated by cold snare polypectomy and 2,400 hot snare polypectomies and found that the rate of post-polypectomy bleeding after cold snare polypectomy was 0.1% in comparison to 0.5% after hot snare polypectomy. Then, next we compare the bleeding rate between cold and hot snare polypectomy after adjusting the background of the lesions. The propensity scores were calculated based on patient age, lesion size, macroscopic feature, location of the lesion, endoscopic clippings after resection, and taking antithrombotic agent. We found that the post-polypectomy bleeding in cold snare polypectomy remains less frequent than in hot snare polypectomy. Thus, after adjustment, we concluded that the rate of post-polypectomy bleeding after cold snare polypectomy for small colorectal lesions was low and less frequent occur than hot snare polypectomy. Future research is needed to clarify the difference between kind of snares used for resection and whether endoscopic clippings are required for cold snare polypectomy, along with details of patient's comorbidity and intake of antithrombotic agent. This would enable studies with robust real-world data and provide us an in-depth understanding of various endoscopic performances. Thank you for your kind attention.